Hi, I am Dr. Seshi Janjirala, interventional cardiologist and endovascular specialist at Pace Hospital, High Tech City. Stent is a metal tissue which we usually place in the blood vessel of the heart, which are known as coronary arteries, when they get obstructed. This disease is known as coronary artery disease, where the blood vessels of the heart get occluded by the cholesterol deposition. So in order to open that, we place a wire, and after that we balloon angioplasty it. We open the blood vessel essentially, and after that, in order to prevent the collapse of the blood vessel, we put a mesh in order to prevent that collapse. This mesh or stent metal which we keep is known as stent, and the procedure is known as angioplasty. Overall, in cardiac procedures, we have multiple various stents. The one which we keep in heart is known as coronary artery stenting. The one we place in the carotid artery is carotid artery stenting. The one we put in the renal arteries is known as renal artery stenting. There are another stents which we put in lower limbs known as peripheral artery stenting, and the another one which we place in aorta is known as endovascular reconstruction. So all these things, there are n number of stents in the body for cardiovascular procedures. Coming to the coronary artery stenting, we have various types of coronary artery stents. So it dates back to 1977, where the first procedure, index procedure, is done by Andreas Grunzing. Like, he passed a wire, he opened the vessel of the heart, and he checked whether the blood vessel stays like that. But there is a instant complication which developed, is like the vessel tends to collapse. So in order to prevent that collapse, in 1987, people started putting stents. But this stent came with a complication known as inflammation, acute stent thrombosis, and in-stent restenosis. So in order to prevent these complications, which was happening with bare metal stents, the second generation stents came known as drug-eluting stents. These are essentially a layer of drug material which are used to stop these complications of in-stent restenosis and stent thrombosis. So in order to put the material over the stent, we need a polymer. This polymer are having another complications known as inflammation, and in order to prevent that inflammation, currently we have polymer free stents and polymer bioabsorbable stents, and the stent thickness are also reduced to less than 65 microns, which is very ultra thin stents. So that's why you get to see a lot of stenting these days with very minimal complications. Stenting is not a permanent solution per se. We are just opening the blood vessel where there is a cholesterol occlusion. If you don't take care of yourself, the stent can get reoccluded, or you might be having a tendency to develop another cholesterol across other blood vessels. So it's essentially a tunnel with a blockage. You have opened it with the balloon and you have placed a stent. If you don't take care of your body, the lifestyle modifications you have to do, you have to take care of your diabetes, you have to take care of your kidney diseases, you have to take care of your hypertension, and all other metabolic parameters needs to be addressed. And you need to be continuous on the monitoring of the tablets as well, which the doctor prescribes you after the stenting procedure, because the stenting is not an ultimate solution. Again, it can have complications if you don't follow the protocol. So stenting is a procedure, depends upon the recovery process, especially depends upon either you are dealing with simple coronary angioplasty or complex coronary angioplasty. The people who get a simple coronary angioplasty, we usually discharge them in a day. Like, we do a angioplasty today and we discharge them tomorrow. If it is a complex coronary intervention, he needs observation for a couple of days as well. It depends upon the usual duration. If we break down, it goes to 2 to 5 days. So if it is more complex, like if the patient lands up in the emergency with cardiogenic shock. Cardiogenic shock essentially is if the patient came to the hospital without any BP recording or with massive tombstoning ECG and in acute state, critical state, with full of sweating and chest pain and all, and patient with significant dyspnea. These patients' recovery will be like around a week or 2 weeks or so, because there will be delayed complications. That's why we call time is muscle. So if you waste time, you are wasting the muscle. It damages, because the blood supply to the heart needs to be supplied every second. Each second is valuable over there. Coming to the risks associated with stenting, if you see, simple coronary angioplasties usually doesn't have any complications. The complex coronary interventions previously used to have very high complication rates because of unavailability of imaging. Now we have imaging in the form of intravascular ultrasound and optical coherence tomography. So these two modalities, what they made us, like we can go into the blood vessel of the heart and we can see like exactly how much is the diameter of the vessel and what is the stent we need to put and what is the length we need to put, and post procedure we can go and see like did we create any further complications, which was we used to be unaware previously. So a decade back these modalities were not there. Now they are widely prevalent and the complications have come down tremendously. No, we cannot generalize like that. The heart disease, especially in coronary artery diseases, where the blood vessels of the heart get blocked, there only we apply this stenting technology. So in other procedures where there are heart failures, we put AICDs, we put CRTDs, we put CRTPs, and we put pacemakers. There are n number of diseases in the heart. Per se, not all the cardiac patients need stenting. There are other alternatives like CABG, coronary artery bypass graft. There are wide variety of advances happened in coronary artery bypass grafting as well. Initially, there used to be traditionally full open cut, but now these days minimally invasive cardiac surgery has become very common. They are using single arterial graft or bi-arterial graft, which has got significant importance. If the places where we cannot put stent, we send the patients for bypass grafting, which has given a great results in contemporary world. Stenting these days has got a very high successful rate thanks to the advances happening in the technology in the form of intravascular ultrasound and optical coherence tomography. If you see, these imaging modalities have brought down the complications to absolutely zero level. So these days, if you compare the complications between a decade ago and now, like it's absolutely like, so the difference is huge. Like we absolutely see no complications these days. Stent is a metal, it's a foreign material. We put it in the body, it gets incorporated into the system. It's not absorbed, it stays with you till you die. There is an endothelium layer which forms over the stent and it integrates. The material which is used is cobalt chromium material, which is not an allergic to the body. It's used in multiple other devices as well. Throughout in multiple medical procedures we use that. So essentially it doesn't cause any allergy, it doesn't cause any reaction unless otherwise, as I told previously, the polymer which stays in the body for a month or to 3 months and it gets dissolved. So now these days we don't see any complications with the stents, newer generation stents which we put. Yes, as we discussed earlier, stenting procedure is done in carotid arteries, in renal arteries, in subclavian arteries, in femoral arteries, in iliac arteries, in aorta as well. We have a number of endovascular interventions which we put stent and open the blood vessel. There are numerous medical conditions where we use them. So stent per se won't be causing any complications if the technique is right and if you use imaging. But if you stop medication which is advised by the doctor who has kept you the stent, then you might be in danger. The complication will be the stent which has been kept in your body is a foreign material. In order to prevent that from occluding, the doctor will prescribe you some medications. If you stop using that without the guidance of the doctor, the stent gets to fail. That means it attracts the chemo-attractant material close to it and it gets blocked. So again we need to open that and it's another story altogether. So if you incline with the direction of the physician or the interventionist who has done the procedure, there won't be any complications at all. No, the stenting procedure is not at all painful. It's usually done by radial route, the radial artery from your wrist or from the femoral side, that is from your groin. We put a local injection. You will be awake. You will be talking to the doctor while doing the procedure. Like it depends upon the simple versus complex given the duration of the procedure, but it's absolutely non-painful procedure. you can return to your normal activities after a day of discharge. Usually we advise for a week bed rest, not complete bed rest, but simple activities like taking a walk, taking a flight of stairs. That's enough. Like not like aggressive. It depends upon your job profile as well. See, if you are a professional who is sitting in front of a TV, you can do it. Nothing wrong in that. You can. If you are a wrestler, then we have a limitation for that, because it depends upon your presentation as well, because your heart might not be ready for that. So we tailor made the decisions of getting back to your work, especially depends upon your job profile. Yes, stenting can be performed in patients with diabetes, in patients with kidney diseases, in patients with liver diseases, in elderly population, in all the age groups. With the given advances in technology, it's quite safer. Yes, stenting is usually safer than other options we have in the available medical sciences, because stenting is simpler and there is no need of any anesthesia. Patient is conscious. We are only giving local injection. Patient is conscious. You need not sedate him. You need not disturb his physiology of the body. So it's generally easy, even with the elderly age group as well. We usually call them after a week, because within first week you tend to resume your daily activities. You tend to have a lot of doubts while taking your regular activities, like what needs to be eaten and how to sleep, if you sleep prone, if you take a flight of stairs, if I lift a weight, do I get something, is it not the correct way of doing it. So I usually call the patients after a week, asking them to write down all the doubts and come back and talk to me. The restenosis and re-narrowing of the stent usually doesn't happen if you are on medications. Only if you stop the medication, then there is a problem. And also, if most of the times, if we use the imaging, like as I said, IVUS and OCT, you won't be having any problem at all. No, stenting cannot prevent any heart attack from happening. Like stenting is a solution after the heart attack happens. Okay, there is a blood vessel where there is a blockage. After the blockage is done, we opened it and we placed the stent. So after placing the stent, it's a solution. It's not a cause. The cost of stenting in India can be varied because of the presentation. It can be mild pain, like while you are walking a distance you might be having pain, or it can be a significant pain at rest. You might be having dramatic pain. So depending upon your presentation, there are various wide of gadgets we use to open the blood vessel. If it is a simple stenting, it will cost you around 2 to 3 lakhs for a single stent. If it is a complicated stent, like it will cost you more, because your heart stops functioning. There are something called as mechanical circulatory support system, like IABP, Impella and ECMO. Using these complicated equipments will cost you a significant amount. So again, it all depends upon the presentation. We cannot give a clear-cut answer like how much within the package. We cannot put a blanket therapy for that. But if it is simple or complex, we can tell, means upfront going to the procedure only, we can tell the patient depending upon his presentation.